Okay, now we're going to be talking about some of the key implementation science conceptual frameworks and theoretical foundations. So the field has completely exploded in terms of theories and frameworks. A recent paper suggested that there are over 170. So I'm going to try and break down what I see as some of the critical ones across different areas. So we'll be talking about some specifically for dissemination, some more focused on implementation, and some that bring in evaluation. So Laura Damschroeder had a paper in 2019 called Clarity Out of Chaos. And I think this is a useful paper too for really helping orient yourself. I think this is an area where people can get overwhelmed in implementation science, but it helps think about determinant frameworks, which are frameworks that are kind of helps you think about the various factors that might impact or influence dissemination or implementation. There are process frameworks, which we'll get into, which might help actively guide and kind of lead you through step by step the adaptation process in terms of adapting an evidence-based program. And then there's evaluation frameworks, and these really help you think about measurement and really bring in the evaluation lens of implementation science. So again, they're all broadly lumped under frameworks, but I think where you might use them and bring them in is slightly different. What's interesting about implementation science, so often we see in a lot of research in public health, people tend to choose kind of one theory and keep it very clean sometimes. In implementation science, people do a lot of blending of different frameworks. People tend to bring in multiple. So again, it's a little bit more of an art. And I think as long as you're comfortable with one or two, I would not try and learn every one, but I try and find one or two that really resonate with you and work with those. What I like about the implementation science frameworks is that context is really key. It's kind of up front and center in most of them, particularly the determinant frameworks. So often in implementation science, they talk about the outer context. So that might be the political context, that might be the community context, the healthcare system. So whatever kind of larger context you're working in, that's often reflected in the outer context. The inner context is the actual setting that you might be working in. So that might be, again, a senior center, a work site, a church, a department of health, a clinic, a school. So that's really thinking about more the nitty-gritty organizational setting and context. But again, based on your setting, your population, various levels might be more or less meaningful for you, but you need to decide kind of which level makes sense and what level of context you're focusing on and that you think will be most important for implementation success. A lot of the frameworks also talk about characteristics of the intervention itself. They talk about characteristics of the key stakeholders, who they often refer to as the population or patients, depending on the setting, or the person delivering the intervention, who, again, could be a lay health advisor, a nurse, a clinician, an administrator, a policymaker. Again, they often have the setting and context with the inner and outer context. And then they often have processes, and these are things like evaluation, planning, training. These are often things that are similar to the strategies we might use to support implementation. So these are typically what we might see reflected in some of the frameworks. So I'll start with one of the more common ones. So Laura Damschroeder in 2009 published the Consolidated Framework for Implementation Research, the Sefer. And this is a very, very commonly used determinant framework in implementation science. So here you can see just visually there's kind of the outer setting, again, the policy setting or community setting, the inner setting, which is the organizational context, the individuals involved, the intervention characteristics, and then the processes, so what's actually in place to support it. And these are all seen as various levels that you would want to think about and understand when you're planning for or understanding implementation. And I'll say the Sefer really focuses on implementation. So where you already have the buy-in of the decision maker, the principal at the school has agreed to adopt this HIV prevention curricula. What will it actually take to make sure that across the New York City school system, it will actually be implemented and delivered? So again, these are just some examples. So actually the website seferguide.org is really, really useful. So Sefer takes an approach, a very mixed methods approach. So you could use Sefer to help guide your qualitative research. If you're trying to understand, okay, I'm going to plan for implementation in this new setting and population, what are some of the things that I might want to understand about it before I actually develop my implementation strategies? So seferguide.org has some really nice tools for thinking about developing your qualitative questions to understand some of these factors. And then a lot of people, Brian Weiner, Maria Fernandez, Michelle Kegler, they've also published on quantitative measures of these, and you'll see some examples on the website as well. And what people have done sometimes is looked quantitatively at measuring some of these and then seen which of these factors actually predict successful implementation. So again, it's overwhelming to try and think about using all of these. I think there's about 32 factors within it. But again, working with your stakeholders and identifying just from experiential evidence, in combination maybe with what you learned from the literature, which of these do we think are really important to understand? Which do we think might be important? And maybe focusing on measuring some of those, or qualitatively trying to get a sense of which of these matter. So again, characteristics of the intervention, what's the advantage? How complex is it? How costly? In the inner setting, what are some of the networks in place that might support it in terms of leadership? What's the culture around introducing evidence-based programs? How ready is the setting in terms of having the resources and capacity and training, the practitioners in place to deliver it? And thinking about the outer setting, again, kind of what's the policy context? How much do external policies and incentives impact your ability to implement it? In terms of the individuals involved, this could be the population you're serving in the community, or this could be the people delivering it. So trying to understand how prepared they feel. Do they have the self-efficacy, the knowledge, the skills, the resources, the support? Does the program fit with the needs of the population you're serving? So, if it's a smoking cessation intervention, but the population you're serving is facing food insecurity and housing insecurity, thinking about how well it might fit or address their needs. So again, always working with your stakeholders and trying to understand that and improve the fit of the actual program. And then the implementation processes. What kind of evaluation, engagement, planning is in place to actually support the intervention? And this one, I think the field has done, it's been a little more vague and has not done as good a job at kind of thinking about measuring this, but it is part of the model. Prism, the practical, robust implementation and sustainability model. So Russ Glasgow and others have developed this. This is very similar to the Sefer model that I just mentioned, but it's a little more specific to the clinical context. So it kind of brings in patient-oriented and patient-centered learning and work. It thinks really specifically about infrastructure in clinical settings, but I just want to present it as one that I think is complementary to Prism, but for clinical settings. And again, some of the lessons learned from Prism, where they've looked at this empirically, is that implementation is more likely to occur when the evidence is viewed as kind of sound and fitting with both patient and professional beliefs. The context, the healthcare context and setting is receptive in terms of the leadership being on board, the culture being supportive of evidence-based practice, and evaluation being in place. And that there are appropriate mechanisms to actually facilitate implementation. So again, if it requires systems infrastructure, if it requires financial incentives, whatever needs to be in place organizationally, that is in place. So again, this is another determinant framework you might think about. So Epis Framework was introduced by Greg Ahrens. So this is the exploration, preparation, implementation, sustainment framework. This framework really has you think about the different phases of implementation. So again, the exploration phase is where you might be selecting the intervention. The preparation is kind of getting ready for implementation. The implementation is like that first 6 months where you're actually delivering it on the ground. And then sustainment is really about that longer view of kind of a year or more out. And it really kind of puts forth this idea that different factors in both the outer context, the policy, community setting, and the inner context, the organizational setting, might matter more or less depending on what phase of implementation that you're working on. And what's really nice is they have a website, episframework.org, that actually links some of these various factors with actual implementation strategies that you might use to address some of these factors. So again, I think it can be a little bit overwhelming to some people as they're orienting themselves because it has so many factors. But again, working with your stakeholders to identify for you all what's meaningful in the outer context that's reflected here kind of empirically as potentially mattering. Again, you all are the experts in your settings, and so are your communities and populations that you work with. So making sure that you're prioritizing and thinking about what might matter, and then testing that out quantitatively and qualitatively, and seeing which of these actually predict, implementation, adoption, etc. So again, this is another example of a determinant framework. An example of an evaluation framework is the commonly used REAIM model. So this was developed by Russ Glasgow. Again, there's also a really nice resource and tool, reaim.org, as you can see here. So REAIM really has you think from a lens of measurement. So REACH is really about, if you're trying to implement this evidence-based intervention, looking really systematically about who gets reached by the intervention, who's impacted, who receives it, who receives the benefits in terms of the behavior change or health outcome of interest. So from an equity lens, I think it can help you be really explicit in understanding within your systems and organizations and contexts, where are the health inequities in terms of who's receiving the evidence-based interventions and not. It has you be explicit about effectiveness. So thinking about if you're delivering this intervention in this new setting, using this new implementation strategy, are you still receiving the same initial impact that you might have had from some of the earlier foundational work that was suggested from the intervention? Are you seeing health inequities again in terms of the health behavior or health outcome of interest? Are there unintended consequences of the program? So, perhaps maybe it does improve physical activity, but maybe then it has implications, negative side effects that you didn't account for. So understanding in these real world settings, are there unintended consequences of some of our programs and interventions? In terms of adoption, we often see health inequities in terms of the settings that actually are able to deliver evidence-based programs or guidelines and those that aren't. So if you're offering this evidence-based program and trying to have it adopted across, this whole school system, are you finding that it's only the high resource schools that are able to actually adopt it? Or are all settings equally able to adopt it? Can it be adopted by low resource settings? In terms of implementation, so again, if you have the buy-in of the principals, in terms of teachers actually being able to deliver it, is the program consistently delivered, and what's the cost of delivering it, and is that reasonable? And then M is maintenance. This is really, again, at the longer term effect. So typically with REAIM, they put that forth as 6 months, but really you'd like to look longer. Can the setting sustain the program without resources? And what are the long term? Do you continue to have the desired impact in terms of reducing disparities, promoting health equity, and actually seeing that the program continues to be delivered? So again, this, from an evaluation lens, is really useful for leading you through these various phases of the implementation process. Again, all the way from kind of effectiveness to adoption to implementation to reach to maintenance. And I know they call it REM, but if you were actually to think about measuring this in real time, it would be adoption, reach, implementation, effectiveness, and then maintenance. So that's kind of the actual order, ARIEM, if you were to actually do this prospectively and try and measure these different issues in your own settings and populations. This is a consort diagram, which I'm not going to go into, but on the website for REAIM, they do present this. And again, I think from a health equity lens, if you're trying to identify where some of the gaps are in your systems and settings in terms of whether or not either populations or certain settings that are lower or higher resources are able to deliver and adopt and implement programs, this can help you be really transparent and explicit and see where those gaps are arising. And it just helps you kind of walk through which settings are represented, which are not, which populations are represented, and which are not. One other evaluation framework is Prism and Prism 2 that just came up. This is really a nice tool for you to work with your partners to really think about, what do you want to prioritize? How real world do you want your evaluation to be? So again, I think this is a great tool to involve and work with stakeholders to make sure that what you're measuring is actually meaningful and valuable. So basically it has you think about, you have the scale from 1 to 5. So 5 would be very pragmatic in terms of what the criteria are, who's eligible to participate, how real world is the setting, how real world is the comparison condition, how relevant is the outcome to the stakeholders. So again, a study that was very well controlled, very narrow, and a little bit more, less real world, less reflective would be, you would do a little dot towards the 1. And then if you wanted to do one that was very representative, very real world, you would want to do a dot that's far out all the way towards a 5. So this can just make sure that everyone in the room in terms of stakeholders are on the same page in terms of how they want the evaluation to reflect real world conditions. And again, I think this is a nice tool, a nice stakeholder engagement tool to make sure everyone's on the same page with how this is being conceptualized in the evaluation. And again, I think it enhances transparency. It kind of presents this as a continuum. It helps prioritize relevance to stakeholders, and again, really it provides an opportunity to reflect real world evaluation conditions. Finally, diffusion of innovations is really one of the only theories that we have in implementation science. This is Everett Rogers' work, who was a sociologist. And again, the idea here is that in understanding adoption and dissemination, that it's really influenced by, again, the social structure of the system, who the key leaders are, who the key opinion leaders and change agents are in the system, the characteristics of the intervention or innovation, as he called it, which is the new thing or intervention that's being introduced within the system, how complex it is, how trialable, what the advantages are of it, and then communication channels. So what are the strategies that are used to communicate about this new intervention and to kind of encourage its adoption. I'm going to go more into this on the session on dissemination, but I just want you to have this in your frame of mind in terms of dissemination. So Rogers kind of proposed that there are these characteristics of evidence-based practices or programs that influence the speed and the extent to which they're adopted within a system. So again, if we're thinking about the HIV prevention curriculum in the New York City school system, you might hypothesize that a curriculum that is lower cost, that's highly effective, that's simple and easy to use, that's compatible with their school system and their workflow, that they can actually observe will have an impact and improvement. Maybe they can observe it at another school or another state that's tried out, so it's observable, and that's trialable, that they could test out. So they might not have to revamp their whole curriculum, but they might be able to test it out and see if it works and then decide to adopt it. So Rogers would propose that interventions that have these characteristics might be more likely to be adopted or be adopted more quickly. So again, a lot of implementation science might use diffusion of innovation to think about our messaging to potential adopters, those principles or that school system, to encourage their adoption. And you might be able to actually test some dissemination strategies based on diffusion of innovation. So that's where we've seen this theory come in. Rachel Tabak and colleagues at Washington University have developed a dissemination implementation model resource where it kind of helps you orient and select a framework or theory. So this is a great tool, and I have the website here if you're interested.